And remember what I said, surgical options, there are no cuts, there are no bruises, all of it is minimally invasive. Yeah.
I see.
Yeah.
And we also have Mercy here. We had another question from Florence, I beg your pardon, Theory, who says, "Good morning, Dr. Ian. Thank you for being on K24. Please guide what brings the change of voice, and you feel like there is something stuck on the respiratory track."
So those could be two things. Number one, remember I said sinuses are pockets of air. So what they do is that they help with resonance. So resonance is the richness of your voice. So when your sinuses get clogged up with mucus, that resonance changes and you speak like this. So that's what changes your voice. That's one thing. And then number two, you get a drippy nose, you know. So you can get a drippy nose forward, or you can get a drippy nose behind your nose, and it goes down to your throat and irritates your throat. So those could be two reasons why she gets a voice change.
I see.
Yes, yes.
We also do have another one here. This particular viewer, he's called Kasheshe. He says, "Good morning." I'm Sharon. What can I use to cure tonsillitis?
So the thing about sinusitis and tonsillitis, those are two different things. And for tonsillitis, it usually depends on your triggers. Okay, so you have to look at your triggers, whether they are, look at your triggers and try and avoid them. Because what the options that we have are medication or surgery to remove your tonsils. Yeah.
Okay, and what are the triggers? When you're talking about triggers, what do we mean here?
Okay, so now for sinusitis, let's focus on that. Some of your triggers are allergies. So you have a patient, especially seasonal allergies. Right now we're in the season of, you can see the city is draped in purple due to jacaranda. But some patients are actually allergic to that. So that will trigger sinusitis. Others, especially during the cold season, they will huddle together and you can get sinusitis, or even just breathing in cold air. Because what happens with cold air is that it dries the mucus, and viruses multiply much better in cold air. So those are some of the triggers. And then of course, anything anatomical, deviated septum, polyps, and of course hereditary as well. So those are some of the triggers, yes, yeah.
Okay. Now, I'd asked you earlier about surgery, but what if it's surgery gone bad? Could you have a case where someone has totally damaged their sinuses and they cannot, go back to getting a remedy in any way? What happens?
No, actually, well, what happens is that, of course, surgery is safe, but surgery does have risks, okay? So, but there's no sinus surgery that doesn't have a remedy, because we call it revision sinus surgery. It's usually a bit more difficult and we take a bit more time, and we have to be very thorough because there are very critical structures around the sinuses. Remember what I said, it's below the eyes, above the eyes, behind the eyes, so we have to be very critical of that. And the sinuses are just below the brain as well. So revision sinus surgery, we do that as ENT surgeons. However, we have to be much more thorough and we have to be much more clinical and surgical with these things. But even for patients who've had surgery before, you can still have other surgical remedies as well. Yes.
Okay.
Yeah, but there are complications even just by sinusitis itself, and yeah.
Let's go back to the question I asked you earlier about during the time of COVID, or even now, in cases where someone may still be getting it, and sinuses, and the difference between the two. Because I mean, it felt like a flu in the beginning.
Yes.
And then you couldn't breathe, so it felt like a different problem.
Yes.
So it was like very many issues in one thing, and all coupled with your respiratory, system. So
yeah, so that was very difficult for us, because you can imagine it starts off the same, looking the same. It looks like a flu, and then it branches off into COVID, and you get respiratory illness and coughing, difficulty breathing. On the other side, it starts as a flu, and what you get is a worse flu. So that was very difficult for us during that period, because of course we could also have gotten COVID just by doing a lot of sinus surgery. So worldwide, sinus surgery actually went down during COVID times. If you look at the numbers, especially here in Kenya and also in America, sinus surgeries went down. And unfortunately, I do know that some people did get some complications from acute sinusitis. And remember, sinusitis is confined in the sinuses, but if it goes beyond the sinuses, then that's when you start getting complications, you know. You start getting some eye problems, abscesses in the eye, you can get meningitis, you can get epidural abscess, very scary big things, you know. But the good thing is that those things are very rare, less than 1%, okay, if it's untreated, yes.
I see.
Yeah, but most complications from sinusitis come to affect your quality of life. So like that patient who says the voice has changed. You can imagine for you who works in the communication industry and you have to communicate using your voice, then sinusitis is a very big deal for you, okay? For you who has to be 100% energy all the time, fatigue will bring you down, you know? If you have a drippy nose all the time and you can imagine you're a pastor in front of the pulpit and
Also
you're giving a sermon
issue.
and you have to blow your nose every 10 minutes, you know, so our sinusitis affects quality of life in every single, symptom. You can imagine you are religious and you're praying 5 times a day, and what are you feeling? You're feeling that your face is heavy and falling off 5 times a day. So that is now where we come in and say, hey, we have a solution for you. Let's try medication, let's try ramp up, let's get maximum dosage. If that doesn't work, then we go into surgery, yes.
You know, I had asked you this in different conversations whereby we are at a point in society where we speak about most issues that we never would in a more concise manner. But we're still at a point where some people may not relate day-to-day issues, you know, regarding their health to their quality of life.
Yes.
Because we're always on the grind, we're always hustling, we're always doing stuff. So when you feel unwell, you just want a quick fix. You see, for example, Dan, the viewer who said he's had it for 7 years, we don't know what his circumstance is, but that's a long time to have that quality of life and that kind of issue. So when you have your patients, what do you tell them regarding, you know, also advising just other people? Because like I said, you can have someone who's lived like that because that's what you're used to. And then the knowledge or lack of it on how expensive or not getting this kind of healthcare is to be treated or diagnosed.
Yeah, so one of the things about sinusitis is that you can get over-the-counter remedies for it. One of the things...
But you have to know.
You have to know. So you get a lot of patients who say, I've been steaming every day for the last couple of months.
Yeah.
You can imagine you've been steaming every day for the last couple of months. What does steam do? It opens up your sinuses temporarily. But then they block up again. And you do that every day and you get used to it and you say, it's just part of my routine. So that patient, that quality of life has gone down, and we tell that patient, do you want a more permanent solution to this problem? Because there are temporary solutions and there are permanent solutions, and we can offer you the permanent solution. Number 2, of course, we can't judge the patient because of their circumstances, but all I can do is give advice and say, hey, I think this is we fine-tune the diagnosis. And some patients are scared of certain diagnoses, either previously or biases and all that.
Right.
But our work is to give you the correct information and to point you down the right path and to hold your hand as you walk through the treatment journey. Because some of it is scary, some of it you're lonely, but some of it is new, but we are able to do that for you as surgeons. Okay?
All right.
Yeah.
We also look at the aspect of religion and lifestyle when it comes to also diagnosing this. Some people will connect it not to, they will not go to the hospital. They'll try and use other religious means. Either they'll pray or figure out a way.
Yeah.
And for some, it works. You know, not everything is in vain. But to what extent can you go without actually seeking proper...
So, the funny thing about sinusitis is that a lot of it is what is called self-limiting. So you will get better. My work as a doctor is to make it more comfortable during that period, or to make it the treatment faster so that you can get to work or to school much faster. So you can imagine I'm dealing with a self-limiting condition, and then you go to your religious leader and ask for a faith healing. Well, the condition was going to get treated anyway. Nature was going to do its work. And then they take the credit. I don't have a problem with religious leaders doing faith healings, but what we call the natural history of the disease was on the trajectory for healing. So there was no intervention that was done. However, there's an aspect of hope and there's an aspect of optimism that is very well, welcomed in terms of healthcare.
So the aspect of faith.
Yeah, the aspect of faith. And hope is super important, yeah.
No, it is. We have Mo who says, hello, Dr. Ian. My daughter experiences nose blockages when it's cold or when she plays much. Could this be sinusitis? And what's the remedy? Now,
remember what I said? Is that sinuses start when you are small, and then they develop, and usually they become a bit more mature when you're a teenager. So for children, they may have the exact same profile of condition: the nose blockage, the runny nose, exposure to dust. You know, like when he said he's playing, so exposure to dust, exposure to pollens out there. And for children, more often than not, the problem is what is called adenoid enlargement. So adenoids, all children have them, but if they get enlarged, then they can cause that problem. And usually adenoids clear up with age, usually at about maybe 6 to 8 years of age.
All right.
So his problem could actually be adenoids.
Right.
Yeah.
And Duarte says, morning, I have had a bad smell coming from my mouth for a while. From my nose, I beg your pardon, for 2 years. What can be the problem? I'm Martin.
So remember what I said? One of the minor symptoms of sinusitis, we call them major, we divide them into major and minor. One of the minor symptoms is either bad smell or bad breath. So that's a patient who requires to be seen by an ENT surgeon. And remember, us at Nairobi ENT Clinic, we do offer a lot of these services. So come see an ENT or come to Nairobi ENT Clinic.
Okay, Ken says, good morning. Kindly ask the doctor what could cause my mucus to harden when I sleep.
Well, he's getting crusts. He could be either breathing in very cold air or be in a very cold place. And usually what we recommend for such patients is to moisten the nose. Remember that thing that we were talking about, nasal douching?
Yes.
It always sounds more scary in your head, but it's very easy to do. Very easy to do.
When I think about it, I'm like, how? I know definitely, you know the anatomy of the skull, but you're like, no.
No, yeah. Most patients at the beginning are like, no, I can't do this. But once they get used to it, after 2 or 3 tries, they're naturals at it. Okay,
we have T, who says, good morning, I have nose blockage I think every other day, and I have to clear mucus in the morning, and also hissing sound on the left ear.
So remember what I said? Ear pressure is one of the symptoms of
the hissing sound.
Or the hissing sound. Oh, okay. So hissing sound could be totally different, but that sensation of blockage every other day, one of the triggers of sinusitis is allergies. Okay, so a lot of patients get morning allergies, and then it clears up. What we usually do with such patients is medications. We have antihistamines, we have steroid sprays, and that can be able to sort them out. So I'd tell them to visit their GP or an ENT.
Okay. I'm not going to do it.
Yes.
I'm not going to demonstrate it, but
yes,
there's this thing, like, you know, you put your, and then you're like...
Oh, like, where you pinch your... so that's called Valsalva.
So, you know what I'm saying, right?
Yes. So let me explain it.
Yeah, like people are like, alafu no, and then you make a sounding from your throat, like you're trying to clear your throat.
You're trying to clear your throat. Okay, I know what you're talking about. Yes,
your index finger in your ear, or your whatever.
So remember I said one of the triggers for sinusitis is allergies. How do allergies present? Allergies are you are allergic to something, either internal allergies, cockroaches, dust mites, or mold, or external allergies like dust, pollen. So what happens is that your body tries to clear that. So you start itching your ears, itching your nose. What you're talking about is called a palatal click. Where yes, it's called a palatal click. Yeah? And you just feel itchy in your entire ENT system. And if that is prolonged, of course, that can block up the opening of your sinus and get a blockade of your sinuses. But more often than not, two things. Avoid the exposure or use antihistamines as needed. For some patients, it's seasonal, so it's just for a short period of time. You remember what I said, our city is draped in purple right now. That's jacaranda season. Some patients, usually it's maybe January where it's a little bit more dusty, or even when you go to Gishagi and you find a lot of hay being cut, and you can actually get the hay fever as well. Yes,
we do have a lot of pollen.
Yes, we do have a lot of pollen. Yeah, and we require, if there are any guys who are interested in biology and especially botany, we need a register of our pollen season, so that we are able to advise our patients during this time period, avoid this place, avoid this place. So a pollen registry would really help in terms of time of the year and place in Kenya. Okay. Yeah, so anyone who's interested in AI or botany or that thing, I put that as a challenge to them.
I see.
Yeah, create a pollen registry for Kenya.
All right. So what then can be a remedy towards the itchy throat and the, you know, the irritable ear? Yes.
It's just two things that we can do right now. Allergy avoidance. And remember what I said, they're internal and external allergens. So internal allergens, that's your pets, that's your cat and your dog fur, carpets, dust mites, and mold. And external allergy, which is dust and pollen. So number one, allergy avoidance. Number two, antihistamines. And then number three, we are not getting any relief, seek a doctor to help. Yeah, okay. We're available for you guys.
Right. Yeah. So if you now understand that the sinusitis that you have is hereditary,
yes,
what can you do to mitigate that?
Yes. Okay. So number one is try and avoid allergens. Number two, hygiene, nasal hygiene and body hygiene. Remember, don't touch your nose. The good thing with COVID is that it has highlighted a lot of personal hygiene. So wash your hands, don't touch your nose, avoid close contact with people who are sick, treat your colds and flus early enough. And then nasal hygiene for those who need nasal sprays, normal saline sprays. Those are some of the things that you're able to do, you know. And if you have any anatomical issue inside your nose, deviated nose, polyps, get it treated early so that you can live a good quality of life. And remember, these things are available both in public hospitals and private facilities as well. Okay,
so is this passed down like that from your...
Well, you need to get a geneticist on the show to talk about how conditions get treated, get passed down from from parents to children, because it's not 1 + 1 = 2. Usually it's like a 18 to 30% chance of getting it. Yes, yeah. So it's not as clear cut, and you get a lot of variations, and again you get skipped generations. Yeah. But I think genetics, there are few in the country. But they can explain much better how the exact mechanism of how it can work.
You can have like twice removed, but then it lands on you.
Then it lands on you, exactly.
All right, so Dr. Ian, we've come to the end of our conversation. And I want to remind our viewers, remember, Glenn Washington is in town, the legendary Glenn Washington, and he'll be performing at the KICC on the 19th of October. And there'll be tickets, of course. You can register on the website. We'll be, of course, showing you a very nice poster of where you can get all that information. And if you're a big fan, like most of us are, and this man has been giving you hits that give you nostalgia, man, you have a chance to see him and watch him and listen to him live at the KICC on the 19th of October. So make sure you get yourself a ticket and experience the legendary Glen Washington. We've been speaking to Dr. Ian Macharia, ENT surgeon, head and neck specialist, and of course he's elaborated to us what the facts and myths around sinuses are. Dr. Ian, thank you so much for coming as always.
Sana, thank you for having me.
We appreciate it. Right, thank you so much for watching Morning Vibe. My name is Remy Majala. We appreciate your feedback and see you again tomorrow morning.